Hi, my name is Joseph Anthony Jerez. I'm from New York City. I'm here at a stem cell clinic in Moscow, Russia. I am a patient, and prior to coming to stem cell treatment, I had a bunch of questions. So I'm going to go over the questions that people are curious about looking into getting stem cell treatment. I'm here with Dr. Alexandra. Her specialty is anesthesiology. She focuses on regenerative medicine. Now, what results can a patient expect from stem cell treatment?
First of all, if we look at the effects which stem cells can do, such as activation of regenerative properties, anti-inflammatory effects, immunomodulating, etc., we can expect with different diseases different results. Last time we spoke with you about general effects, and today probably we will talk about children, about autism. This problem is very actual for many families.
Yes, exactly. Now, keep in mind, this is our second video together, and in this particular video, we're going to focus on autism. So please elaborate on your success rate with treating autism.
At the moment, according to our experience, it is about 85%.
85% success rate.
Yes, for children who has autism. And here we should clarify that if we take 100 children, 85% of these children will have positive dynamics. Of course, it's something individual. Some children can have maximum improvements or minimum, but still there are some improvements, some positive changes.
Okay, so basically improvement can vary from patient to patient based on their level of autism, their physiology, if they have other health problems, things of that nature.
Exactly, because the response for the stem cells therapy, it is something individual, and results, of course, are also individual. There are rest 15% of cases when there's no obvious effects, and even for these families, some trials proved that it's better to have some additional therapy, because there were trials when after 3 months period the dose with umbilical cord derived stem cells were done, and even each 3 months during 1 year. And even those children who didn't respond at the beginning, then after the second, third therapy session of therapy, they had improvements.
Oh, okay. So basically, if the person being treated for autism didn't show improvement after the first infusion, you shouldn't be discouraged, because they can show improvement after the second infusion, the third infusion. Okay.
Yes, and as we discussed before, the improvements we can expect after 1 month till 6 months period. That is why when we are our colleagues, when they did their trials and did it each 3 months, it's to cover these positive things, to have opportunity for more improvements. Do you understand what I mean?
Yes.
Okay.
I understand.
Okay. And of course, the family should aware that it's really individual. The results are individual, and nowadays this disease can't be cured. But certain positive things the family can have with the stem cells therapy. And I'd like to tell you one very interesting story. The patient from Israel came to us. It is a boy. He was 5 years when he started the therapy, and he had all symptoms, typical symptoms of autistic child, such as repetitive actions, not following parents' commands, and living in his own world. He had as well seizures. He took several anti-epileptic medications, so medication that could help with this problem, but even taking them, he had 2 cases when even it was problem with his breathing, and he was taken to the hospital. And the family, after the first treatment with the stem cells, his mother informed that the episodes of seizures stopped at the
Really?
moment.
He stopped having seizures?
Yes. So as we discussed, there are many effects of the stem cells, and obvious effect like activation of neuroplasticity in brain, and activation of new neuronal pathways, so-called synaptogenesis, more connections between neurons could be observed, plus anti-inflammatory effect, immunomodulation. All these things we can suggest took place.
Okay, now how did it affect his development, his educational development? Did it improve?
Yes, it's a very good question. Before the therapy, he went to special school because of this basic problem, and after the first treatment, his cognitive functions, ability to learn information, to cooperate with children, improved greatly, and even his teachers at school informed about it, plus parents, of course. And at the moment, he finished his 3rd therapy, and now he goes to ordinary school.
Wow, from going to a special school for autistic children, now he's developing on a normal level, and now he's in an ordinary school with other students. That's great.
Yes, that's true.
Wow.